Let's chat.
As the pandemic continues, one thing you've got to say about it, it's helped all of us learn a whole lot more about how our bodies operate and about staying healthy. To that extent, Dr. Robert Huang is joining us now, and Dr. Huang is a cardiologist with CHI Memorial. First of all, Dr. Huang, thank you so much for spending a few minutes of time with us. I would imagine those of you in the medical profession, you are learning a lot about how this coronavirus impacts the body. Tell us more specifically how COVID-19 impacts the heart.
So, I think at the beginning of the pandemic, it was, I think we were in this everybody was just trying to, react to the COVID-19 infection and, trying to limit the spread. But we know that, but afterwards, people are very thoughtful and have been doing a lot of studies about this. And we know, we still don't actually know what the extent of the heart damage is that COVID-19 causes. There were recently two studies out of Germany that basically showed they used a cardiac MRI to look at damage that was done to the heart. And they found, up to 60 to 70% of people had inflammation in the heart even after their infection and after they were symptomatic. So I still think that there's probably more to come on that. Mm-hmm. But we also know that that COVID-19 also causes more inflammation in the heart, and that can put people at higher risk for forming blood clots and also forming and also having heart attacks. So
it is accurate to say that if you have underlying heart conditions, the impact on COVID could strike you greater, correct?
Yes. So people, obviously, there are people who have high risk conditions, diabetes, heart disease, people who have had prior heart attacks and strokes are going to be at higher risk for having a worse outcome with COVID-19. So again, these people fall into the higher risk groups. Again, also people who are elderly, higher risk, and trying to,
right.
It's important for them to be masking and limiting their social interactions so that they don't get this before the vaccine comes out.
Can you give us let's say 30 seconds on the importance of patients, especially cardiac patients, continuing to receive medical care even though we are in a pandemic?
So yeah, I think that this I looked up some statistics last night on this. They said there was a 60% reduction in admissions for heart attacks during the pandemic. 40 to 50% of patients fewer patients were coming to the ER, and there were 38% fewer life-saving procedures or CATs that were being done. So we were doing everything we can at Chattanooga Heart and CHI Memorial to keep patients safe when they come to the ER. At the hospital, we are limiting visitors. We're screening all visitors for temperatures and symptoms. Everybody wears a surgical loop mask. We have increased sanitation. Patient rooms are cleaned every time somebody leaves, and then we're basically doing physical distancing in our waiting rooms and common areas. So just wanted to reassure people that it is safe to come to the hospital, and that if you're having a life-threatening symptoms such as chest pain, shortness of breath, stroke-like symptoms, that it is safe to come in and get evaluated, and that we would be happy to treat you.
Dr. Robert Huang, thank you so much for joining us. You can find out more about how the great folks at CHI Memorial are battling this COVID on our behalf. Check it out, CHI Memorial. They have got 6 locations around the viewing area. ChattanoogaHeart.com will get you more information. ChattanoogaHeart.com.